to take care of potentially catastrophic situations. Many of us just had severe anxiety during the pandemic, thinking we were bringing this home to our families. There was a bunch of us that went to learn how to do mass casualty training in case we needed it. So that was a little scary, and that's kind of when it really hit home for me. The vaccine rollout went pretty smooth at our hospital. I've never experienced an emergency use vaccine or an emergency use really anything in my lifetime. I've been pro-vaccine. I mean, my kids are vaccinated. We rolled them out to pretty much like essential workers and that and all that first. There were many that were excited about it, and I understand we were all looking for a way out. After rolling them out then to the kind of general public, the elderly and in nursing homes in the area, we would get elderly in with COVID. It was kind of interesting. And it was weird. It was almost like a week after they would get their first dose, they would test positive for COVID. And then we started seeing patients coming in, I got my vaccination and a week later they're in with pneumonia. I can say for sure in 2021, this is the year of pneumonia. Independent of COVID, I've never seen people with so many pneumonia, sepsis, and even in the middle of summer, all summer, that's what we would get in the hospitals, pneumonia, pneumonia, pneumonia. After the vaccine rollout, I definitely noticed an uptick in heart attacks, strokes, blood clots, gastrointestinal bleeds, gastrointestinal complaints, appendicitis. We even saw pancreatitis, recurrent cancers. It was noticeably increased, where it wasn't just me noticing it, everybody seemed to notice it. It became clear to me that there was something wrong. I knew nothing of VAERS, the Vaccine Adverse Event Reporting System. I didn't know about our responsibility to report. It was never even talked about when these vaccines were rolled out. I mean, you'd hear it in the news here and there, but there was never this push to make sure providers were made aware that if you're getting patients in the hospital with issues, these issues, whatever, that here, you got to go to this website and start reporting and start paying attention to stuff. That was never educated to us at all. And I went on the website, I looked, and the first thing I noticed was that it said healthcare providers are required by law to report certain adverse reactions to VAERS. And I said, what do you mean? Like, what law? So, and then you look further, and it had a whole section on it, exactly what you're supposed to report. Specific things you're supposed to report to VAERS after the COVID vaccine rollout. So that's when I started reporting patients on my own. Well, very quickly that became a full-time job.